Dr. Peter Balogh of the Vancouver Centre for Cosmetic and Implant Dentistry here in Burnaby, British Columbia. Today I'm going to talk to you about implants, the actual surgery. What is it like? Am I going to be in a lot of discomfort? Will I be able to go to work the next day? A lot of people think that implant surgery has got to be really uncomfortable, really painful. And it's understandable. They've heard of people who've had wisdom teeth out, had gum surgery, and now they're envisioning somebody coming along and making an incision, drilling a hole in the bone, and then putting this titanium rod or screw into place. It just sounds unpleasant and painful. Actually, it's not. In fact, it's much better than a lot of other things that we do in dentistry. And probably the worst thing that we do in dentistry is gum surgery. And even wisdom teeth, I would say, are generally, people have a harder time, they're more discomfort and so on with wisdom teeth than, say, with implant surgery. So why is that? Well, a lot of the soreness that we get comes from inflammation. And where does the inflammation come from? It comes from the soft tissues. It doesn't come from the bone. So what we do within the bone really doesn't cause any issues. It's or discomfort, or very, very little. It's what we do with the soft tissue. And so how we manipulate the soft tissue and what we have to do with the soft tissue, the gums in other words, determines how we're going to fare. So hence, when we do gum surgery for various things, grafts, this and that, people generally do have a lot more soreness. Even wisdom teeth, back here there's an incision, but and it may not be very large, but we have to push the gum back, and there's muscles here, there's a lot of movement back here, so it tends to cause a lot of swelling in these areas and tends to cause a lot of soreness. When we're doing implant surgery, oftentimes we don't necessarily have to manipulate the gums that much. In fact, we try as much as possible to be very conservative in our approach, because if we do, then people fare very well. Sometimes we don't even have to make an incision in the gum, and that's a lot of times that's the best way. People have literally no soreness, no swelling, no inflammation. So surgical protocol is important. Our approach, our technique of how we approach it, even the length of time that we spend doing the procedure is important. If we do the same procedure on the same person, we spend 45 minutes with one on one side and 3 hours on the other side, that side that had the 3-hour procedure, that person will get a lot more swelling and inflammation and soreness than the side that was done in 45 minutes. So we don't want to be rushed, but we want to be efficient with our time. Certain procedures could be done with more conservative access than others, and we try to do that as much as possible. To put it into a scale of 0 to 10, I tell patients ahead of time what to expect. 0 being 0, 10 being very severe. I tell most people your pain level will be around a 3 or 4 typically, and generally 3 or less people do fine with Tylenol, Advil, Motrin, ibuprofen. Around a 4, 5, and 6 people typically would need Tylenol 3, Tylenol with codeine. Anything more than that, they need, of course, something stronger. Tylenol 3 won't touch it. So most people do fine. They have a pain level. I tell them it's going to be around a 3 or 4. I tell people to take a Tylenol 3 before the freezing wears off. And quite often they tell me they didn't need anything further after that, or sometimes they said, yes, I took some Tylenol 3 and I needed it for the first day or two, but after that I stopped. So generally, most people do very well. Their pain level is typically around a 3 or 4, sometimes a little bit stronger for the first 24 hours. And once again, it depends from person to person. It depends, are we doing one site? Are we doing 3, 4 sites at the same time? Are we doing simply an implant? Are we doing a bone graft? Are we doing multiple sites? Are we doing an implant and bone graft? It really varies from person to person. Some people literally can go back to work that very same day. Others can go back to work the next day. In other cases which are more involved, I tell people about 3 days, and that's usually the most. I tell people 3 days, and then you'll be fine to go back to work. At that point, there may still be a bit of swelling, a bit of inflammation, but it's not to the point where it's unbearable. The other thing, besides the procedure that we do, besides our surgical protocol, is if we give certain medication, then that can help to minimize it. Medications we give are anti-inflammatories, corticosteroids, and if we give those in the right dose at the right time, it can reduce the amount of inflammation that people get. By reducing the inflammation, we reduce the normal histamine response, which is our body's response to injury and inflammation, and that is important. I mean, our body can't heal without this inflammation and this body's normal response. But if it's over-exaggerated, if you get extra response than we want, of course there's going to be more swelling, more soreness. And if we give the right medication, it minimizes that, and by so doing, people basically fare a lot better. They don't have so much soreness. Age can be a factor. People who are older are typically not as healthy. Their livers may not work, liver enzymes may not work, they may be on medications, so that can certainly affect things. Even some of my senior patients may not be on medications, but for whatever reason they bruise easily, they bruise more, they bleed more, and so this can lead to more inflammation. Also too, even our outlook plays a role. Some people are just very positive. They just, no problem, I'm going to heal fine, everything's going to be just fine. I've had others who say, you know what, if anything goes wrong, it always happens to me. And I don't know what the real explanation is of that, but generally people who have a more positive outlook seem to fare better. Whether they have a higher pain tolerance, and that's why, I don't really know, unfortunately. But certainly our outlook on things can affect how we seem to heal. Even these people with maybe have not the best of experiences, maybe a little bit negative outlook, they still do well, and sometimes they're pleasantly surprised. They realize that they've known in the past things have not gone well for them, and all of a sudden, lo and behold, everything just works out just beautifully. So it doesn't explain everything. Nevertheless, these are some of the different things that you can expect as far as implant surgery. If you're about to undergo some implant surgery, ask your dentist to give you a reasonable expectation of, do you need to take time off work? Are you going to have soreness? Are you going to have swelling? To what degree? And what sorts of things can you do to minimize that? A couple other things to mention is icing the area for the first 2 days following surgery will help. Keeps the swelling and inflammation down. Just like any other injury, if you've hurt your shoulder, you ice it for a couple days. After about 48 hours, though, you want to switch to heat, because heat will open the capillaries, open the blood flow to the area, and help the body to heal. So hopefully this gives you some rough ideas, hopefully takes away any concerns and fears that you might have. Implant surgery is not so bad. It's actually better than a lot of things that we do. And if everything is planned and protocol is ideal, you'll actually do very well. So good luck with it. If you have any questions for us, you can always email us at info@vccid.com, and you're certainly welcome to call us. But email works wonders, and I can answer your questions if you have any. Thank you.